Pediatric Case Study Developmental Delay by Ana Chavez and Rebeckha Cuevas. The child we got to see presented with developmental delay with balance and coordination issues, which were the mom's main concern. The mother stated that the child was clumsy and would trip on his own feet and bump into furniture, causing bruises on both legs. The child also presented with right lower extremity anteversion and pain to both lower extremities, which increased at night. Developmental milestones. By the age of 4, a normal child should be able to perform a single leg stance for 4 to 8 seconds, while this 7-year-old patient was unable to do so without handheld assistance by the physical therapist assistant. When the child was asked to skip, he would be uncoordinated and compensated with running. Skipping should be done by the age of 5. To hop on one foot, the child required handheld assistance and presented with loss of balance. An observational gait analysis was done on the child. The child presented with right lower extremity anteversion, decreased heel strike, and narrow base of support. In the article listed above, a study was done to assess the effectiveness of using a Wii game console as a form of therapy for children with poor motor performance. 29 kids were divided in an experimental and control group, with the experimental group being seen 3 times a week for 30 minutes for 6 weeks. The balance was assessed using the Movement Assessment Battery for Children test and the BOT2 test. The intervention consisted of ski jump, Segway circuit, obstacle courses, and skateboarding. The results showed significant improvement on balance skills in the experimental group. Using the Wii as a form of therapy has shown to improve both dynamic and static balance, not only in children, but in older adults as well, making it a great intervention. Since it is a form of play, it also helps to increase motivation for therapy on a child. The Wii serves as a pre-intervention, which also increases balance and coordination and allows the child to progress to more challenging contemporary physical therapy interventions, like using the stationary bike or running on the treadmill. The Wii is an immersive activity that can also be used at home, which is a great way for the whole family to be involved. Other treatment interventions include play therapy, which is most often used at clinical sites. This will require creativity from the therapist. Play therapy allows the child to play games while doing treatment at the same time. This includes things like hopscotch, lily pad leap, and bumblebee bot. Another form of therapy is virtual reality. Reflective statement. When working with children, a creative approach is required to get a child motivated and ready for therapy. Many challenges are presented because kids can get easily distracted during the course of therapy. Educating family members, especially parents or caregivers, is crucial for the child to acquire the milestones necessary for daily function. After working with this child, we understand that a highly individualized treatment intervention is necessary in order for therapy to be effective, since not all children have the same attention span. Thank you. My name is Ana Chavez.
And Rebeckha Cuevas.